Pancreas is an organ which is situated in the upper abdomen behind the stomach, and pancreatic cancer is one of the leading cause of cancer-related death all over the world. And unfortunately, its incidence is increasing, and it affects both men and women, mostly in the middle age. The symptoms and signs of pancreatic cancer depend upon the site and stage of the disease. Generally, it has some non-specific symptoms like loss of appetite or unintentional significant weight loss. And some of the specific symptoms are painless jaundice, or what we call discoloration of yellowish discoloration of eyes, or they can have high colored urine, clay colored stools, generalized itching, and some patients do have mild abdominal discomfort or pain, and blood with the stools. So these symptoms, when they develop, patients generally tend to ignore them initially, and eventually they land up in the hospital or see their physician. When it's being evaluated, it's found that they have pancreatic cancer. Now, these pancreatic cancer, its treatment depends upon, again, the site of the disease and the stage of the disease. We need a thorough investigation of these symptoms, and they should be taken seriously. We may need to do multiple set of investigations, and some of them are like routine blood investigations with the radiology, which we have is an ultrasound abdomen. We do a CT scan, which is probably a gold standard to look for any suspicious lesion in the pancreas. We may also need to do endoscopic ultrasound, which will also enable us to take biopsy from the lesion. And then once it's confirmed the pancreatic cancer, its treatment generally depends upon, again, the stage of the disease. And most of the patients require a multidisciplinary approach. They need to be discussed in a multidisciplinary meeting, where surgery is the mainstay of the treatment of pancreatic cancer in stage 1 to stage 3. This stage, the surgery also depends upon the site of the disease, and the most commonly what we see is a pancreatic head carcinoma, which usually requires surgery followed by chemotherapy or radiotherapy. Now, this surgery is also a major operation, and it has been seen that the complications are less if it is done in a high volume center, where they have a full team where the complications, if they arise, can be managed accordingly. So generally, if a patient has any of these symptoms, they should usually consult a doctor as soon as possible and get the treatment started. And once the surgery is completed, they again need chemotherapy or radiotherapy depending upon the stage of the disease, and they need a very strict follow-up as per advice given by their surgeon. And once it is treated completely, they generally do well after the operations, and we keep them under the follow-up to see whether they have a recurrence and treat them accordingly.